Good evening, everyone, and thank you for joining us. My name is Brett Spitali, and I'm the Vice President of Advancement here at NHF. Joining me is Sharon Myers, CEO at HFA, and Dr. Leonard Valentino, CEO at NHF. With the current environment upon us concerning COVID-19, NHF and HFA wanted to come together to address the community, provide you with information, and answer any questions you may have. If you do have any questions, we ask that you please type them into the Q&A section at the bottom of your screen. I'll now turn it over to Sharon Myers from HFA. Sharon?
Hi, everyone. Can you hear me?
Yes.
Okay, good. Sorry, I lost my phone call, like right at the second I was supposed to speak. So sorry about that. Log back in quickly. Okay, so I'm going to go ahead and get started. So thank you so much for taking time out of your day to be with us on this call. It's wonderful that we can come together to provide information, answer questions, and simply connect. And I'm going to start by doing kind of a state of HFA, and then I'll turn it over to Dr. Valentino at NHF for the bulk of the conversation. So as far as the state of HFA, we're fully operational. We've halted all staff travel and closed our office in DC. Many of us worked from home prior, but now all of us are working from home. And we're also spending a lot of time making sure our staff have what they need and that they're happy and healthy. And we're trying to make each other laugh a lot. It's kind of like on the airline where they tell you to put your mask on first. I think we're all finding out how important self-care is so we can truly give our best to others. So as you probably know, we postponed symposium, and I want to announce on this call that we have secured a new date. So mark your calendars, August 24th through 26th, same city, same location. So we had limited options since we take over the entire venue, all the hotel rooms and the meeting space, and this was really the best option. And basically what we wanted to do is we wanted to pick up symposium completely intact and move it over to the new date. So we hope to see you there. We're working hard behind the scenes in collaboration with our amazing bleeding disorders organizations to keep up with the ever-changing pace of information. We're committed to providing you with as much information as possible. We created our COVID-19 hub page, so all of our information is in one place, and we'll put that link in the chat. Organizationally, we're ramping up social media, and we'll be pushing out information on mental health and positive parenting and working from home, as well as more salient topics like supply chain concerns, access to care, loss of health insurance, things like that. So keep an eye out. We also realize that this is a very uncertain time financially. So our Helping Hands Emergency Financial Assistance Program is fully operational. We have a team of 3 people and a committee here to help you should you need assistance. The needs are great, and we want to help as many people as possible. Finally, we want to hear from you. Reach out to us and let us know what you need, your concerns, and keep being a strong partner with us. We're all in this together, and we're all stronger together. So before I introduce Len, I want to leave you with this quote by Maya Angelou. Stand up straight and realize who you are, that you tower over your circumstances. So with that, it is my great pleasure to introduce Dr. Leonard Valentino, President and CEO of NHF. He'll be leading our call today. So prior to his role at NHF, Len, as he likes to be called, was the VP and Strategy Lead for Hematology at Spark Therapeutics. For more than 2 decades, he worked in academic medicine, where he was the director of the Rush University Haemophilia and Thrombophilia Center in Chicago. As a well-respected hematologist, he's treated many hemophilia patients, published more than 160 peer-reviewed manuscripts, and participated in all phases of clinical research trials, as well as leading a research laboratory investigating the molecular basis of joint disease in hemophilia patients. So Lynn, I will turn it over to you, and thank you so much for being on this call.
Thank you, Sharon, and thank everybody that's on this call for your time this evening. First, I'd like to share my sincere hope that you and your loved ones are staying safe and healthy. As we continue to monitor the rapidly evolving situation with COVID-19 and this coronavirus infection that's now turned into a pandemic, our priority remains the health and safety of our employees and our community, the patients. It's critically important that we all stay healthy together, and as Sharon said, we're stronger together when we speak with one voice. So we're all attempting to find new ways of working during this challenging time. Our team is fully functional as well at NHF, and we'll talk a little bit about that as we talk about the commitment that we continue to have towards the bleeding disorders community. So what is NHF doing? As I said, we're fully operational. The staff is not traveling, and all staff are working from home as our New York City office is closed. We've created various online resources to ensure that you have the latest information on COVID-19 at your fingertips. We've also implemented a weekly newsletter, which will be posted on our website. We're scheduling regular teleconferences with the community, such as this, and we'll continue to provide NHF programs and services to the best of our ability. It's important to recognize that we'll be working with you to help prioritize these programs to meet your needs and the needs of the community. So before I go any further, I just want to start with a couple things that I think are really important to get. And that first one is that we all should be considering our own health and safety. So are you feeling sick? The symptoms of COVID-19 are fever, cough, and shortness of breath occurring 2 to 14 days after exposure. So it's important to recognize that physical health, but as Sharon said, it's also important to maintain our emotional and mental health as well by staying active. I think we also have to recognize the importance of where we are as a country. And as the US Surgeon General, Dr. Jerome Adams, said in an interview yesterday, we have a choice to make as a nation. Do we want to go the direction of South Korea and be really aggressive and lower our mortality rates? Or do we want to go in the direction of Italy? And as many of you have heard, Italy had more than 400 deaths in the last 24 hours, and their death total has now surpassed that of China. So we really need to do some things very aggressively in the future to control this pandemic. So I think the three things that the Surgeon General is advocating and we all could follow is these: know your risk, control your circumstances, and get the facts to take action. The coronavirus.gov website is a great clearinghouse and is now considered the go-to spot for all your coronavirus information. So for general information, that would be the place to go. Let's talk for a minute about some of the points that he had about knowing your risk. Well, I think it's important to recognize what the risk factors are, and we'll talk about those in the next slide. But first, let's talk about controlling your circumstances, something that's really easy for all of us to do. Limit your exposures, avoiding travel and public transportation. It's important also to limit your use of ride shares. Practice good hygiene, washing your hands frequently and washing surfaces that are frequently touched. Avoid touching your face. No gatherings of greater than 10 people is now the recommendation. Social distancing should be practiced, and that includes no play dates for children. I know that's challenging, but again, it's an important action that we need to take. And avoiding exposures of older family members who are at risk. So if you do have little kids in the home, it's really important to try to limit their exposure to adults. In terms of getting the facts to take action, it's important that we look at all the information that's available on the HFA website, the NHF website, and of course, the government website, corona.gov. Also looking at state and local health department websites. And remember that testing does not preclude risk. Social distancing also does not mean social disengagement. And at this time of our pandemic and the crisis with as many people in the intensive care units, the US blood supply is at a critical level, about 30% of what we normally have for the blood supply. If you're healthy and not having any symptoms, you should consider donating blood at this time. Remember that blood banks are very adept and skilled at preventing infections. So you should feel comfortable and safe going to a blood center to donate blood at this time. Well, let's talk a little bit about some of the facts versus the fiction. We heard recently that the CDC came out and said blood disorders are at more risk. Well, let's talk about that for a second. Who are the people that are at higher risk? Well, we said older adults, those older than 80. And I will say also that 8 out of 10 deaths that have occurred in the United States have been in adults 65 years of age and older. So older adults clearly are at a greater risk. And then people who have serious underlying medical conditions like heart disease, diabetes, lung disease, including asthma, HIV, and sickle cell disease. So when the CDC is referring to blood disorders, they're really referring to HIV and sickle cell disease, not hemophilia. Next, let's talk about the concerns if you have a port. Well, you have to practice good hygiene with a port as it is. I don't think having a port necessarily increases the risk for COVID-19. Comorbidities, we just talked about those. That does not necessarily include hemophilia. But I will say, if you have hemophilia with an inhibitor, the inhibitor alters the immune system. And we don't know what the implication of that is in terms of coronavirus infection and COVID-19 disease. So people who have an inhibitor should take special precautions to limit their exposures, practice good hygiene and social distancing. What about if I'm in a gene therapy clinical trial? Well, we know that the use of steroids in the gene therapy clinical trials is fairly frequent. Steroids are an immunosuppressive drug, and this would increase one's risk for infection, including COVID-19. So again, what can I do about it? It's those special precautions. Can you take extra precautions? Well, I think again, it's good hygiene, cleaning those surfaces that are frequently touched, avoiding social contact to the best of your ability. Those are all really important measures to take that we all should be doing anyway. But if you're using steroids, if you're using steroids because of asthma, you may want to practice extra precautions and take extra care. What does immunocompromise mean, and who does that apply to in the bleeding disorders community? I would say the two populations that we have to be concerned about are those individuals who are on gene therapy clinical trials who are receiving steroids, and importantly, our patients with inhibitors where we don't know what the implication is for COVID-19 disease because of that inhibitor. Am I more susceptible to a bleed? Well, you shouldn't be more susceptible to bleeding except if you have severe cough, and that cough could result in bleeding into the head. Now, let's also talk about what you should do if you need to go to the emergency room for a bleed or a possible infection. If you feel sick, you should be cleaning your hands often. Cover your cough and sneezes. Avoid sharing personal household items. Again, cleaning high-touch surfaces every day. If you're sick and going to an emergency room, wear a face mask. This is really the only instance where a face mask may be beneficial. What you're doing by wearing that face mask is limiting other people's exposure who you will come in contact with, including the healthcare workers who you're seeking attention from. Call ahead before visiting your doctor or an emergency room. Make sure that they're aware that you're coming. And then again, monitor for symptoms. And again, if you have severe symptoms such as difficulty breathing or shortness of breath, persistent pain or pressure in your chest, confusion or the inability to arouse, or bluish lips or a bluish face, seek medical attention urgently. So if you go to the emergency room for a bleed or a possible infection, again, I can't emphasize enough, call ahead. Next question, I'm very worried and anxious about this situation. What can I do to ease my worries? I think we're all anxious and worried about this. But what we can do is maintain our emotional, physical, and mental health. So as Sharon said, there's resources on the website for that. Relaxation and meditation, exercise, and then getting enough rest is really important during these times. Talking to others. We're all in this together. These are all things that we can do to help ease our worries. Who should I be looking for answers about medical issues? Well, of course, you should be seeking answers to your medical questions from your physician, from the Haemophilia Treatment Center. Ask them any of the questions that you may have. What should I do if I think I have COVID-19 infection? Well, again, it's all those things that we just talked about. If you're mildly sick, you should stay at home. Limit your exposures to other people in your home. Practice that social distancing, which is really important. You should also monitor your symptoms on a regular basis, monitoring your temperature, monitoring your breathing, all of those things that if you begin to have any of the signs that I mentioned before about serious disease, call ahead and seek medical attention from an emergency room. Let's talk for a minute about supply chain and delivery concerns. People are asking on a regular basis, how much factor product should I have on hand? Well, the current CDC recommendation, when you look at that, says a 30-day supply. That's a bit misleading. Those are for general medications. That's for high blood pressure medication, heart disease, diabetes, asthma medications. The current MASAC recommendation is to have a 14-day supply of factor products available to you. And one should reorder when you have a 1-week supply of, left. So it's important that we keep the factor supply available not only to our patients, but to all patients. People have asked, why can't I get a 90-day supply? Why can't I have more product on hand? Well, there's a number of reasons why this is not such a good thing. One is that it will divert product potentially from other people who may need it at that time. Somebody might be having a head bleed and they're going to need more product. So we don't want to deprive people from having their products by having hoarding product going on. There's also implications for payers, insurance companies, and importantly, the employers, where this could put an undue burden upon them and result in a financial stress that could result in more job loss and more stress for the community. Another question has been, is there enough factor inventory in the supply? Well, we believe that there is. We've had several conversations with manufacturers. The manufacturers assure us that their supply inventory is sufficient. The supply chain is robust. We've also had conversations with specialty pharmacies and the Haemophilia Alliance pharmacy as well. And the factor inventory is there. It's available when it's needed. So we don't have concerns about the supply chain. We believe that the hemophilia treatment centers, as well as specialty pharmacies, have enough factor to supply the US population. Where there's a greater concern is ancillary supplies. Thinking about the supplies that are needed in hospitals to take care of sick patients. These are alcohol wipes, butterfly needles, syringes, all the ancillary supplies that a hemophilia patient needs as well. So it's important that we keep the appropriate amount of supplies again and don't hoard those supplies, which may be vitally necessary for patients who are critically ill in a hospital. Other questions about supply and delivery. How do I know if my pharmacy has enough factor to distribute? Well, we've also been in conversations with those specialty pharmacies about this. and we're assured that their inventory is adequate to meet the needs of all of the patients. What if we go into shelter in place? Will my pharmacy be able to ship factor to me? Again, because of medically essential products and drugs, shelter in place doesn't apply to the delivery of that. You can leave your home, even if you're in a shelter in place situation, to pick up medications because those are vitally necessary. It'll also be possible for shipments to go out and delivery services to be used to provide product to people that are in a situation where they're in shelter in place. So we don't have concerns about this in terms of the delivery or the receipt of product. What if I can't get nursing to come to my home? Again, this is a concern because of, we're all at risk to get sick, and the nurses who do this home care are at risk. We're assured by all of the providers of nursing care, including the hemophilia treatment centers, that the nurses are regularly checked. They're being asked, are you sick? Do you have a fever, etc.? And ensuring that the people who are coming into your home are well. It's also important to recognize that if we don't need the nursing to come in, we should try to allow that person to care for somebody else who may need their services. So we're pretty confident that we'll continue to be able to get nursing to come to patients that need them. Another question has been, I use a plasma-derived product. Is there a reason for concern about having enough plasma donations to make my product? Well, the supply chain for plasma-derived products is robust. And again, we're assured by the manufacturers of plasma-derived products that the inventory and supply chain is adequate to meet the needs. It's also clear that plasma donations that are made today don't go into plasma products that are administered tomorrow. It takes several weeks to months for that supply chain to come to fruition. So it's important, again, to recognize the need for blood product donation as well, and plasma donations. So if you're well, consider making a blood donation. In regards to insurance coverage, I'd like to turn the opportunity to Michelle Rice, who can make some comments on this. Michelle?
Thank you, Len. Welcome, everyone. We understand that a lot of transition is taking place during this time period as well. We understand that people are being misplaced from their jobs. So there are some concerns about how will I get new coverage. I wanted to make sure that everyone knows first and foremost that Medicaid enrollment is open all the time. With respect to losing a job, that qualifies as a qualifying event, which means that it will open up a special enrollment period for you with the marketplace plans. But even more, trying to find out where you should go, what you should do, I wanted to let you know that NHF and HFA have worked together to create a new insurance resource that is up on both of our websites. It's called Insurance Coverage Concerns and Unanswered Questions. You can go and it will provide you with some information on if you've lost your job, where should you go next? What should you do? There's also the email addresses for both HFA and NHF for you to reach out to us for individual help. We both have folks that are experts in health insurance, both commercial and the public insurance. So you can go to advocacy@hemophiliafed.org or advocate@hemophilia.org, and we will share that with you. The same goes with respect to a need for financial assistance. We will be able to provide you information on where you can go for financial assistance, specifically if that is for premiums and copays. But there are also, if there are other emergency financial assistance requests, we can direct you to where you can find that assistance as well. So again, just remembering that you're not alone and we are here to help. Also, your HTC social worker is a very good resource for you in the event you lose insurance. I'll turn it back over to Len.
Thank you, Michelle. So before we open it up for questions, I want to emphasize that this is a challenging and frightening time for all of us. But we will get through this crisis, and it will require each of us to work with everyone else to keep everyone informed, but most of all, safe. We are all in this together, and together we will get through this. So we'd like to open it up for questions. And again, the two email addresses at the bottom are available for questions.
Thank you, Len. Our first question is, are there any more recommendations for adults with HIV or hepatitis C?
Well, again, the recommendations really need to come from your primary healthcare provider, and whether that's your HIV clinician or the hematologist who's caring for you. It's important to stay in regular communication with your physicians. So I would strongly advise that you seek recommendations and suggestions from your healthcare providers.
Thank you, Len. Next question is, I've heard that people with inhibitors are at higher risk. Does this mean they're at higher risk of getting it or having a negative outcome if they do contract it?
Well, as with this rapidly evolving situation, there's a lot that we don't know. We don't know what the situation is for patients with inhibitors, whether they're more likely to be infected or whether, if infected, they'll have more serious complications. We can take a little bit of information from what we know about, for example, pregnant women. We know that pregnant women, there's a small number of cases where COVID-19 has occurred in those pregnant women. We know that their immune system has altered as well, just like hemophilia patients with inhibitors, but possibly in very different ways. We don't have enough information for either of those populations to understand what the implications of coronavirus infection are for pregnant women or for hemophilia patients with inhibitors. All I can emphasize is stay in regular contact with your hemophilia treatment center provider, and also take special precautions because we don't know what the implications are and whether the risk for infection is any greater, or if you do get infected, whether your symptoms can be more severe. So again, take the precautions seriously and practice them well.
Thank you, Len. Next question is, we are going into full lockdown in our city soon. We are anticipating delays in deliveries due to staff shortages and transportation issues. We tried ordering Factor as week early and are having pushback from the specialty pharmacy and insurance company. Tried to explain that we cannot just go to the corner pharmacy for our medications. Wondering if this has been addressed by the national organizations, any advice or support?
Yeah, and again, as I said, we've been in regular contact with the specialty pharmacies and talking with them. Michelle, I don't know if you have anything else to add in this area?
Yes, I would just let you know that we are reaching out to the insurance companies, and we've had conversations with at least 3 or 4 of the largest insurance companies in the country. And remember, this is a change for them. This is required to allow you to refill early is something that the federal government has suggested. However, most pharmacies are governed by state insurance rules, and not all states have put out the mandate or the suggestion that insurance companies are to allow the early refills. But we are working with them on a regular basis. So I think if you have those questions that arise, try to work with your insurance company, or you can reach out to me at NHF.
Thank you, Michelle.
Thanks, Michelle. Next question, Len. Any special precautions for those with HIV and contracting coronavirus?
Again, we assume that there may be some increased risk because of the HIV infection. And it would be the same precautions that you would take at any other time to limit your exposure to somebody who's ill, especially those who have respiratory symptoms. We're also learning now that about 30% of individuals who present with COVID-19 may have GI symptoms. And it's believed that the virus is also shed into saliva and then swallowed and may enter the gastrointestinal tract. So limiting exposure to individuals who may have vomiting or diarrhea, as well as a cough, would be important for those who have HIV infection. And I would also add to that those who have inhibitors.
Great, thank you, Len. Next question, how does the use of steroids increase your risk?
Well, steroids are an immunosuppressive agent. And again, we don't have enough information. There haven't been enough cases to really understand this. And all we can do is err on the side of safety at this point. So anybody who's taking steroids, and I would emphasize even for asthma, we should be practicing excellent hygiene. The social distancing is really important. And by all means, avoid exposures at all possible.
Thank you, Len. Next question. What about those who have visits scheduled soon at their HTCs? Should we cancel them?
I think it's important for you to discuss the need for you to visit the HTC with your healthcare providers. So the nurses, the nurse coordinators can help you make this decision. I think it depends on whether the visit is for an elective reason or not. So again, it's not a simple answer that I could give. I would suggest strongly that you contact your HTC and discuss the visit that's coming up and whether you should keep that visit or not. There may be extenuating circumstances where that's really important that you visit with the HTC.
Great. Thanks, Len. Next question is there no risk of having COVID-19 in blood products?
Well, at this point, again, we don't believe that the coronavirus is found in the blood. Again, I think this is an evolving situation, and we're continuing to study this. But at this point, we don't believe that that's the case. So we do believe that the blood supply is safe for the general population from donations, as well as factor products, plasma-derived factor products, and recombinant products who have stabilizers from human plasma. So I think it's important to recognize that this is a rapidly evolving situation and research is ongoing. We don't have the answers at this point, but we do believe it's safe.
Great. Next question, Len, is NHF's Bleeding Disorders Conference still happening in August?
At this point, we're continuing to have this on the schedule, but again, we are continuing to monitor the situation, and we will make a decision at some point in the not too distant future as to what the fate of that conference is. I think it's really going to depend on whether we follow the path of South Korea and get a handle on this quickly, or we follow the path of Italy, where the number of cases is increasing and the number of deaths is rapidly increasing. So I think it's going to depend on what we all do together as to how soon we're going to be able to resume somewhat of a normal life. So the answer to that is we're monitoring it at this point, but it's uncertain as to whether we'll be able to proceed with that or not.
Thank you, Len. Next question. You mentioned in today's email that coughing can precipitate ICH. Are there actually case reports of that, or is this more of a theoretical than real?
Of course, it's a theoretical issue. Personally, I've had patients who've had severe coughing and have had, for example, scleral hemorrhages, as well as petechiae on the face and head because of the increase in pressure when you're coughing, that increased thoracic pressure. So although theoretical, I think it's potentially a real concern. And again, it emphasizes the point to stay in contact with your hemophilia treatment center and also maintaining your prophylactic regimen as well as possible to prevent that from happening.
Excellent. Thank you, Len. Next question. If you are on prophy, does that protect you against the issues you mentioned with head bleeds and coughing?
Well, it definitely will decrease your risk. Will it protect you totally? I don't think anybody can tell you that, and I don't think we know that at this point, but it will definitely lower the risk. So I cannot emphasize strongly enough that we should continue to have the patients treating according to the recommendations of their healthcare providers and the HTCs.
Thanks, Len. Next is a bit of a comment that you might want to elaborate a little bit on. I know you and I were having conversations about this earlier. Please put a plug for telemedicine. Most patients can be seen on their own smartphone if they have one.
Yeah, I think the government is looking at ways to lessen the restrictions on telehealth, and I think they're moving in this direction to allow more telehealth to occur at this point. I think it really is dependent on both the provider as well as the end user to be able to have video capabilities. So it can be done. Certainly with a smartphone, it's possible. But not everybody is skilled at providing these types of services. So there will be a learning curve for this. But I've heard several instances where telehealth is being done and being done successfully. And it also limits exposure of somebody who's potentially infected with coronavirus to healthcare workers. So I think we can get information that we need, and we need to all work together to increase the availability and the skills for telehealth in the future.
Great. Thanks, Len. Next question is, can you address the use of NSAIDs and COVID-19, and if any current treatment regimens contain ingredients that bleeding disorders patients should avoid?
Yeah, so there's been a lot in the lay press about the use of nonsteroidal anti-inflammatory drugs and which ones you should or shouldn't avoid. At this point, there's no evidence that any of the nonsteroidal anti-inflammatory agents increase the risk for infection or severe infection. My understanding is that it was a hypothesis that was put forward because of the receptor that the virus uses to enter the respiratory cells, that may be altered by a nonsteroidal anti-inflammatory drug. But at this point, according to the FDA, in a notice that was even issued as recently as yesterday, they stated that there was no evidence to support that hypothesis at this point. But again, it's a rapidly evolving situation, and the research is ongoing, and that opinion may change as we move forward. But at this point, there's no evidence to support that.
Okay. Thanks, Len. Next question. Will COVID-19 delay or postpone hemophilia research because the major drug and biotech companies are focusing on the virus and putting hemophilia research on hold?
Well, I think that we're going to see that it's challenging not only for biotech companies, but for universities and hemophilia treatment centers to continue to participate in these research studies when there's minimization of elective visits and procedures going on. So I have to believe that there's going to be some stall and slowing of the cadence of clinical trials in the United States. I think that major universities are already seeing this in terms of their clinical trial network. Trials that are involved with drugs that are life-sustaining, cancer drugs, heart trials, where those visits are necessary for life-saving, I think will definitely have to continue. But we have to consider, these other trials and put them into context. So all I could say at this point is, again, stay in contact with your hemophilia treatment center, your provider, and the principal investigator for any trial that you're in to understand what the plan is for continued trial participation in the near future.
Okay, thanks, Len. Next question. Are there any known cases of COVID-19 in our community, the bleeding disorders community? Will we know if there are?
To my knowledge, we don't know that. I'm sure there are. As we learn of these, we can certainly share that information within the guidelines of patient privacy and protection. But again, my guess is that as the infection is spreading throughout the community in general, I suspect that there's a number of COVID-19 cases in the bleeding disorders community as well.
Okay. Next question is, can coughing and pneumonia cause lung bleeds?
It's certainly possible. Again, depends on the vigor of the cough, and again, we don't know what the implications are for COVID-19 in the hemophilia population until we are able to gather this information from patients.
Okay. On that same note, the next question is, should we also place concern over bleeding that could close air paths, throats, due to coughing?
That's a very unlikely scenario. Again, a conversation with your healthcare provider would be in order to help you understand these concerns. I don't think we really can understand your own personal risk for something like that, and it would be best addressed by your healthcare provider.
And I believe, Len, that we are at the end of the questioning. We don't have any more questions. If you do have questions, we'll ask you to put them in the Q&A section there. I don't see any new additional questions. Len, I'll give you and Sharon the opportunity to close things out if you'd like.
So I would like to just thank everybody for the time that you spent with us. And again, can't emphasize enough that please do everything in your power to limit your exposures, practice that good hygiene and social distancing. And if you do feel sick, take measures to protect yourself and those around you, including your family members. And again, call ahead before you seek medical attention. We're all in this together, and together we'll get through this, but we all have to cooperate and do what's necessary. So Sharon, I'll leave it to you to wrap up and end our call this evening.
Well, thank you so much. Again, thank you all so much for being on this call, and thank you to the NHF and HFA staff for putting this together. And Lynn, you did a beautiful job as always. Again, I just want to say to everyone, stay connected, don't be alone, stay, check social media, check our web pages, stay connected to all of us. We're all in this together. And we're going to be stronger. You think about this is we're going to eventually get through this, and we're all going to be better for it.
Thank you.
Great. Thanks for joining us, everyone. We appreciate it. We hope you have a pleasant evening. And again, reach out to us with any questions or concerns. Thank you.